Americans will be bracing for their health insurance premiums to skyrocket. That's because the pandemic-era subsidies that made ACA plans more affordable are expiring on December 31st. Remember, Congress is gone home. They home like y'all. They went home for the holidays. And the GOP healthcare bill that passed last week, likely going nowhere in the Senate, does not address the expiring tax credits. According to an analysis by KFF Health News, premium payments are expected to more than double on average. Listen to how Jeremy Coolish, one of the Americans getting his health insurance through the Affordable Care Act subsidies right now, explained the impact of this when he was on our show just last week.
Without the subsidies, I've seen the premiums for that plan go from less than $400 to about $1,600 a month. I definitely cannot afford that. They've been working to overturn the Affordable Care Act ever since it was first passed, to score political points or what have you. But these are real people's lives, millions of real people's lives you're playing with.
Joining us now, Dr. Vin Gupta, pulmonologist, global health policy expert, and MS Now medical contributor. Doctor, thank you so much for coming on. Let's start right there where Jeremy left off about the real people. The CBO, nonpartisan, scored that 4.2 million Americans will not have health insurance by 2034. So the real life impact, when you're thinking about it as a doctor with the people that you see and the ability for them to actually come to the doctor, how are you thinking about the real world impacts of this?
Well, Eugene, good morning. This is going to worsen what we've already seen. We have an imperfect system right now, and it's going to get worse because healthcare for 24 million people that relied on more affordable health insurance, the Affordable Care Act exchanges, is going to get more expensive, as you just pointed out in that tee-up. The real life patient impact is that people that previously thought twice about going to urgent care for that cold that might have been flu that needs early intervention, or skipping a cancer screening, all these trends, Eugene, are going to become a lot worse. People will skip care. We're already expecting about 5 million people will go uninsured. And then there's the plight of the underinsured. Just for your viewers out there, what does that really mean? That means if you spend greater than 5% of your gross annual income on your deductible, and that shift towards increased cost sharing, higher deductible health plans is going to happen. And it's not real insurance because people are going to skip care.
And how does that impact people who do have employer-based healthcare, right? Because the system, the way that it's shaped right now, could be fixed by Congress, but they want to be at home. Everybody impacts everybody. So people not going or being underinsured or going to the hospital without insurance impacts all of those who still have employer-based healthcare as well.
I'm glad you brought that up because there's this concept of risk pooling that I know we don't talk about a lot publicly because it's a difficult concept to explain. But the idea here is that if people start to just go uninsured, that those that have coverage, the remaining pool that are still going to buy in because they have healthcare needs, maybe they're sicker, they have chronic diseases, it's going to push up costs for the rest of the people in the system, including those that are getting their employers, their insurance through their employer, because it's the same group of insurers in some cases that have to now deal with perhaps a sicker pool of patients that need coverage. So what are they going to do? They're going to increase rates for employers that cover their people that are employed by them. So insurance premiums are not just going to increase for people within these Affordable Care Act exchanges. It's going to be for everybody, Eugene, as you pointed out here, those that get Medicare, those that get their insurance through their employer. It's going to increase across the board because everybody's dealing with higher prices.
Doctor, I want to ask you about the proposals that Republicans are putting out there as some kind of replacement for not just the Affordable Care Act, but also for these enhanced subsidies. You have also pointed this out, that if Republicans move forward with some kind of health savings account for Americans, that just 4% of HSA contributions nationally in 2023 were made by people with incomes below 50, meaning that health savings account benefits don't actually go that much to low-income earners. What does that mean for low-income earners? And also, can you explain how these HSA accounts would impact people with pre-existing conditions?
Yeah, absolutely. I'm glad we're talking about what solutions are actually being discussed right now, because you're going to hear a lot about We've already heard a lot about health savings accounts in the tee up to the holiday recess. What are they? These are tax sheltered savings accounts. Basically, those that are tend to be more affluent take advantage of these accounts because they're tax deferred. If you put $2,000, $3,000, like the Trump administration is talking about, into one of these accounts, these are pre-tax money that you can actually invest. And so those that tend to actually utilize them are those that have disposable cash. As you pointed out here, those that have higher incomes utilize them. Those that have incomes that force them essentially to buy insurance on the ACA marketplace do not use them. They don't have disposable cash. So HSAs are not are regressive. They do not actually benefit those that need them the most from an income standpoint. That's one. Two, that's exactly what Republicans are talking about. Let's just send people checks, $2,000, and assume that that's going to cover catastrophic care, which it will not. This is not comprehensive health care. It's not an alternative for actual meaningful healthcare reform. That's the hard work of statutory law and actually doing something about these subsidies, which is what actually a bipartisan group of members in the House are suggesting they're going to do come January and the end of the recess, put forward a vote and do a temporary extension of the subsidies and force the hand of the Senate. Senator Thune, the majority leader, said he is not going to actually support that. So where are we? We're not in a place, and just to talk about it for your audience here, we're not in a place where real solutions are being talked about for prices. The reason we have a health insurance problem here in the US is because we pay the highest prices for hospital care, for drugs. We're making some headway on drugs with Medicare drug price negotiation. The prices are the big problem. You're not hearing anything about price reduction really at scale. Underinsurance, we just talked about it, driven by high deductible health plans. We should be moving towards making sure people across the country have chronic disease management coverage that is pre-deductible. Make sure they have it. Make sure that care does not actually have to go towards one's deductible, so that everybody has preventive screening and basic care. And then really gaps in coverage. Employer-sponsored health plans have gaps in coverage. That's where we need the public option. For Medicare, we need the 10 states that didn't expand Medicaid to be serious. Those people their people actually want Medicaid and benefit from it. We aren't hearing these actual solutions here across these dimensions.